Are boxers prone to certain neurological issues? Boxing, a combat sport dating back centuries, has captivated audiences with its intensity and raw athleticism. Boxers train rigorously to develop their skills, strength, and endurance. However, behind the glamour and excitement of the sport, there is an underlying concern about the potential neurological issues that boxers may face. It is no secret that boxing involves repeatedly delivering and receiving blows to the head. These striking blows can result in concussions, which are a type of traumatic brain injury. The forceful impact can cause the brain to move within the skull, leading to inflammation, bruising, and damage to brain cells. Over time, these injuries can have long-term consequences on a boxer's health. Chronic traumatic encephalopathy, CTE, is a well-known and concerning neurological condition associated with boxing. CTE is a degenerative brain disease that affects individuals who have experienced repeated head trauma, such as boxers. The symptoms of CTE can include memory loss, confusion, depression, and even aggressive behavior. The disease progresses over time and can be debilitating, impacting an individual's daily life and cognitive abilities. Research has shown that professional boxers are at an increased risk of developing CTE due to the repetitive head trauma they experience throughout their careers. In fact, a study published in the American Journal of Sports Medicine found that neurologically impaired boxers are more likely to have abnormalities on brain imaging compared to their healthy counterparts. These abnormalities can include atrophy, shrinkage of brain structures, and enlarged ventricles, indicating changes in brain volume and fluid distribution. Furthermore, studies have indicated that even amateur boxers, who may not compete professionally, are not immune to the potential neurological consequences of the sport. A study published in the Journal of the American Medical Association found that among a group of amateur boxers, 87% had abnormal brain scans indicative of brain injury. These results highlight the risks associated with boxing, regardless of the level of competition. It is important to note that not all boxers will develop neurological issues. Factors such as the duration of a boxing career, the severity of head injuries, and individual susceptibility to brain damage can vary among individuals. Additionally, advancements in protective gear and changes in boxing regulations have been implemented to minimize the risk of head trauma. However, the potential for long-term neurological consequences remains a concern in the boxing community. Recognizing the potential risks, organizations like the Association of Ringside Physicians have called for stricter guidelines and increased medical supervision to ensure the safety of boxers. These guidelines may include mandatory neuroimaging screenings, longer recovery periods after head injuries, and comprehensive medical evaluations to monitor a boxer's cognitive health throughout their career. In conclusion, boxing, a sport admired for its courage and strength, carries inherent risks, including potential neurological issues. Boxers, both professional and amateur, are exposed to repeated blows to the head, which can lead to concussions and, in some cases, chronic traumatic encephalopathy, CTE. While not all boxers will experience these neurological consequences, the risks are present, and efforts to improve safety measures and medical supervision must continue. Only by understanding and addressing these concerns can the boxing community strive to protect its athletes and ensure the longevity of the sport.